So diabetic retinopathy, as the name implies, is a condition that we see in diabetics that affects the retina. And so here's a model of the eye. It's the front part of the eye. The retina is the inner lining to the back wall of the eye. And the retina is really important to vision because it has millions of light receptor cells which allow us to see the image that's projected in the eye. And as you can see from this model, the retina has numerous small blood vessels. And diabetes is a condition that affects small blood vessels. The blood sugar, when it goes to high levels, it irritates and damages the inside of the small blood vessels in the body, especially in the retina. And when that happens, it can cause some blood vessels in the retina to close off and not supply good blood flow to the retina. It can also cause some of those blood vessels to be damaged and leak. And the fluid that's flowing down the bloodstream, the serum, can leak out of the blood vessels into the retina and cause the retina to swell. And so that's one major condition that can cause vision loss in diabetics, is swelling of the retina, which we call edema. And if that affects the very center part of the retina, which we call the macula, that can cause blurry vision and require treatment. A second problem that can cause vision loss is when those blood vessels close off in more advanced stages of diabetic retinopathy. That can cause small blood vessels to grow into the eye in the area, and that sounds like it's a good thing, but those small blood vessels are not functional and they can break and cause bleeding into the eye. And the eye can fill with blood, so a patient can suddenly see little spots in their vision corresponding to spots of blood in the center of the eye, or their eye might fill with blood, and so they have a red haze to everything that they're seeing. And so, fortunately, there are ways that we have to treat this, which include laser treatments, sometimes injections that we perform, and occasionally we have to do surgery.